here for our August 2024 edition of Prevention Exchange and our very last Prevention Exchange in the series. Hopefully you received the reminder email yesterday with a little more detail about what's next for the center as we transition to some new initiatives, and we want to make space for you to be able to attend those. I'll share more at the end, but my name's Jen Morrell. See lots of familiar names and faces with us today. Thank you so much for joining. I have the pleasure of serving as the managing director for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. And before we move on and let Tessa Miracle, our esteemed moderator, take over, I'd like to open us up and welcome us to Prevention Exchange by just sharing a little bit about the center. Essentially, we are about 2.5 years old, and we serve as Ohio's central access point for all things related to behavioral health prevention and promotion across the lifespan. Tessa or Sophia, could I get the next slide, please? Our goals, thank you. Our purpose and our mission is really to assist preventionists, public health professionals, those who have an interest in prevention and public health or work closely with them, to institutionalize those core components and really focus on the science of behavioral health prevention and promotion. We like to diffuse and support the implementation of research-informed frameworks. We like to make sure everything in Ohio is evidence-based, but understand that Ohio's communities are very different. So some of the evidence-based materials and initiatives out there might need to be tailored to meet the needs of your community. And that is one of the beauties about Prevention Exchange and what comes next for our project Echoes, in that it provides a place for Ohio's prevention public health communities to grow with and learn from each other as we work to address prevention and public health issues across the state. So with that in mind, I'm sorry, Wendy. Oh, thank you for being here. To our panelists, Stephen Gregory and Sherry Sullivan, and I'm going to turn the show over to Dr. Tessa Miracle. Thank you.
Hi, everybody. Thank you so much for joining us. We are so excited that you're here. I really appreciate you taking the time out of your day. We are really excited for today's presentation. We're looking forward to hearing from Stephen and Sherry. As a reminder, that you're welcome to ask questions in the chat. Today it's going to look a little different. We're going to have a presentation from Stephen. We're going to have a little bit of breakout time. We're kind of going back together. We're going to hear from Sherry, and then we're going to report out together. So it might look a little bit different than it has in the past. I just want to remind us that today we're really hoping that we're going to explore meaningful opportunities to collaborate with senior adults. And then we're really hoping to identify successful programming and ideas that will help us combat social isolation and loneliness among senior adults. So I am going to stop sharing, and I am going to hand it over to Stephen, who is going to share his screen, and he is now a co-host. So I'm going to let you introduce your project, introduce your programming and your goals.
Yeah, absolutely. Good afternoon, everyone. I apologize for not being on a little bit earlier, kind of had a last minute situation pop up. So give me just a second to see where to share my screen. And that's not coming up for me. It's not actually even really necessary, Tessa, if that's okay.
Absolutely. Go right ahead.
Sure. So good afternoon, everyone. My name is Stephen Gregory. I am a project manager for St. Mary Development, as well as a master trainer in what's referred to as the WISE program. Along with that, I am an adjunct professor of sociology with Sinclair Community College. I've been working in prevention since 2013, and I have been an adjunct professor since 2018. My background actually comes with working with more the youth population, and over the course of the last 4 years since COVID, I've been working with the senior population. So it's very very exciting work and very meaningful work. So I'm going to tell you a little bit about what it is that we do. And also, I'm going to talk about one of our initiatives, which is called the Older Adult Behavioral Health and Wellness Initiative. So, a little about St. Mary. So, as far as what we do, St. Mary Development, we develop affordable living communities for seniors as well as veterans. So in doing that, we connect residents to services that allow them to live independently. We are just now, as of this past June, celebrating our 35th year as an organization. We have over 50 apartment communities in Ohio, which breaks down to being roughly about 3,000 units. We just opened a new community in Kettering, Ohio, that has 52 units. We just celebrated our grand opening, having House representatives there and people from numerous agencies and whatnot that have been very instrumental in helping us with the process. So, what we experience in working with older adults is that older adults have very unique experiences, they have unique needs, they have very their own set of difficulties as well, actually. So, with St. Mary's, our mission is to serve those individuals that we have to ensure two primary things which tie into good prevention. One, to make sure they can live independently, and two, to make sure they're able to do it at a justifiable cost. So, the span of counties, and I'm sure I'm leaving one or two out, but I know we have properties in Montgomery County, Greene, Butler, Warren, Clinton, Hamilton, Claremont, Mercer, Auglaize, Logan, and Dark. And I believe Shelby and Champaign are in that as well. So we address a lot of the accessibility needs that seniors have before they need to ask for them. That's what makes St. Mary's a little bit different than other agencies, especially in terms of real estate. What we know, what the data says, is more than 40% of homes are not disability accessible. However, 20% of seniors have disability needs. So we're able to encourage that independent living because it could be very difficult for a senior to say, I need a grab bar in my shower. Or, as I've said numerous times, I'm in a wheelchair, but the mailboxes are 6 feet high. We address those concerns before the senior ever needs to ask for it, and we make sure that we do it at an affordable rate. Roughly 25% of seniors have incomes just around 25,000 per year. The median retirement savings for someone 55 to 65, 64, 65 is around 90,000. So that means that for a good amount of the population, living until the age of 85 means you could very easily be living on $3,000 a year. It's very, very difficult. That's, taking a yearly income that some people make in a month and having to spread that over 12 is very difficult. Also, what we do is we address the issues of isolation. So, in a recent study, more than 30% of adults 45 and over reported feeling lonely or socially isolated. 25% of seniors over 65 reported themselves to be either extremely socially isolated or in general socially isolated. So we combine four things together. One, as I discussed before, is real estate development. So that goal in our mission to create disability accessible, affordable, and secure housing in order to not only just improve the quality of life for our seniors, but that's going to improve the quality of life for their families as well. The next step that we put in that is what we refer to as service coordination. So we provide supportive services inside of every one of our communities. And what that does is that service coordinator is able to help that older adult navigate things like Social Security, Medicaid, Medicare, SNAP benefits, being able to navigate those things. Although we love our advances in technology, it has become increasingly difficult for some of our seniors that maybe they don't have a smartphone. And if you're familiar with just the process, at least in Montgomery County, I'm sure over the state, in applying for benefits, you've got to know the street you lived on in the sixth grade, and you've got to be able to upload attachments. And for those seniors that aren't able to do that, our service coordination staff is front and center to help with that. We also help seniors navigate reducing evictions, dealing with lease violations, all those things. We have someone in house for that, which ties us right into prevention. So when I came to work for St. Mary's in 2020, I came on as a prevention specialist, and one of the first things we discovered is you guys have been doing prevention for 34 years now. This isn't new. It's just that title with that. So we use evidence-based education. We provide resources to prevent substance misuse, addressing social isolation, mental health issues, etc., really making sure we focus on those social determinants of health. If we're able to reduce evictions, then we're able to create economic stability, etc. So we know that the rate of growth with our older adult population is something we really, really need to be focusing on. By the year 2030, 25% of Ohio's population is going to be 55, 65 and up. By 2035-ish, it's going to be running with youth that are 0 to 12. So we've got to be able to accommodate for that, because along with that comes the issues of substance misuse. And about 65% of people 65 and over reported high risk drinking in the past year. And a lot of that can be due to that social isolation that we're talking about. So, what we also know with the data, the reason that we tie into this older adult behavioral health and wellness is if approximately 2% of Medicare enrollees that are 65 years and over meet the diagnostic criteria for a substance use disorder, that means that roughly 48,000 Medicare recipients in Ohio have an untreated substance use disorder. That really speaks to the need for good prevention. We do good housing, we've got to make sure we do good prevention too. So the Older Adult Behavioral Health and Wellness Initiative, that's something that St. Mary's partnered with Ohio Moss and our local Adamus board. We also utilize the services of UADOP of Dayton as well as PASS. And our goals were to identify and train organizations in a few key strategies: prevention education, early identification of risk factors, utilizing QPR. So we've got a non-invasive crisis questioning for suicide prevention, and giving education on healthy lifestyle choices that go outside of just food choices. So really what that does is it ties in the biopsychosocial model. So what we did, so we've got this great plan, and how do we put it together? Well, the New Jersey Prevention Network, which came up with the WISE program, certified 8 people as master trainers. So they're able to train facilitators. 2 of St. Mary's employees, including myself, are master trainers. So what we did with this facilitation training is train people in WISE, train them in QPR, train them in SBIRT. So they're more equipped to not only deliver the program, but also be able to understand the other things that could come along with the WISE program. So WISE is a 6-week educational course that stands for Wellness Initiative for Senior Education. And it has 6 lessons, usually done weekly. First lesson is called Changes Associated with Aging. And it really tries to reframe how seniors see the aging process. Next is aging sensitivity, where we discuss more the sociological aspects of aging. What is aging in the larger society? The third lesson is called Valuing Cultural and Generational Diversity. This lesson gives seniors the opportunity to explore and understand that they are a diverse population. Those of you that have worked with older adults, there's a very large difference between someone that is 55 and someone that is 75. Their perspectives can be very, very different. But we also tie in how they are similar and the same. Then we start getting more into prevention. The fourth lesson is called Medication and the Older Adult. This is learning how older adults can prevent education misuse. I was a police officer for a long time. And when I would educate seniors about medication safety, I would often have to remind them that when you're selling your home, you may have people come for your open house, and the first place they're going is into your bathroom because that's probably where you're keeping unsecured medications. So it's giving that kind of information, how to have conversations with your doctor, how to ask questions. Lesson 5 is substance misuse and addiction. We really start exploring the disease of addiction during that time, signs and symptoms and understanding. Then it ties into the 6th lesson, which is called an enhanced quality of life. So this is really that biopsychosocial model I was talking about. Good ways to care for your body, care for your mind, care for your spirit. And with just a couple minutes left, I'll just brief over the data that we found as outcomes. So one of the most wonderful outcomes of the WISE program was 84% of the participants that finished the program made some sort of behavior change directly related to the program. This could be reducing substance use, using a pill box to organize their medications, keeping a list of medications in their purse or wallet, changing doctors, asking doctors more questions, talking to a friend or a counselor when signs and symptoms of depression might come up. The Older Adult Behavioral Health and Wellness Initiative, we've trained over 90 facilitators in the past year, and we've served over 1,200 older adults in the program. So we've had good numbers, and that's even continuing. We're still training facilitators. We're still implementing the WISE program. That hasn't stopped. It's increased, and the interest in the program has been great. The other things that we're able to do with that is by offering incentives for completion of the program, we're also able to address food disparities. That's something I am very, very passionate about. So by giving a senior a gift card or a food basket or a fruit basket, we're able to alleviate some of the food disparity issues where cost is concerned. Or maybe offering cleaning supplies. We all know how expensive cleaning supplies are. So we're able to address other issues that seniors might have. And all that together is just what good prevention science looks like. We're assessing, we're implementing, we're planning, we're building capacity, we're evaluating the program. So by putting those things together, we're able to do a lot for our seniors. So that really, in a nutshell, is St. Mary's and what we do and the WISE program.
Awesome. Thank you so much, Stephen. I really appreciate this overview. It was really helpful. We now have 10 minutes set aside for breakout rooms. So we're going to drop some questions in the chat that you can take with you. We'll also broadcast them in the room. But we really want you to discuss with one another how you've seen social isolation change since COVID. So that could be, what factors or dynamics have come up. And what other needs do older adults have that you think are not addressed enough is one of our other questions. So I'm going to create these breakout rooms. Sherry, Stephen, you're welcome to join your breakout room. You're also welcome to stay in the room with us. Just as a reminder, everyone, we pause the recording so your breakout rooms are not recorded. So if there's any language you're struggling with, or if you have a question that you don't quite have wordsmith just right yet, that's your space to do that. So I am opening your breakout rooms. They've been randomly assigned. So you should see some sort of notice pop up on your screen that says join this breakout room. Please feel free to join. You're also, you may see the option at the bottom ribbon. There will be an ellipses and the option to click more. That might be where you see the breakout rooms pop up for you. If you're having trouble joining your breakout room, you are welcome to unmute. You're welcome to put something in the chat. We're here to help you. So I see the numbers slowly dwindling, and we will be back together in 10 minutes.
To work on getting people back out.
Welcome back, everyone. Thank you so much for sharing your discussion. I could see your microphones moving the whole time, so I'm excited to hear about your great discussion. I know we had kind of our own
Great. Thanks so much. And thanks for inviting me to talk about our program. We're very, very excited about it. It's relatively new for us. So my name's Sherry Sullivan, and I'm the Director of Clinical Services at Family Pride of Northeast Ohio. Family Pride is a community mental health center, and we serve Ashtabula, Lake, and Geauga counties. We have a little bit of spillover into Trumbull, a little bit into Cuyahoga, just depends on, proximity to our office. The unique thing about us is that we do primarily in-home services. So we bring mental health services to the client's home. And we've been doing that for a long time now and had a lot of success with it. And Family Pride, again, just offers counseling and case management, mental health services. We also offer a big parenting program and a reentry program. And then we have a program for the aging population, which is what I'm going to talk about today. We're really excited about that. And we've been doing it now about 3 years in Geauga County, and then we added Lake County and Ashtabula County as well. So essentially, we are always looking for underserved populations of people. A lot of community mental health centers kind of just do the same thing at everyone. And we really, because we're in-home and mobile, we're really looking for those underserved populations where we could make a difference. And we know that the aging population is growing, and they're also very underserved when it comes to mental health. We learned very quickly that the aging population has unique needs and preferences when it comes to receiving services that are labeled as mental health services. So we had a few challenges in the beginning. All of our paperwork, consent to treat, and those kinds of things were very, they were worded in a way that was very familiar with mental health services. So it was mental health a lot all over the paperwork. And we had a lot of our aging population say, I'm not signing that paperwork because I don't need mental health treatment. I need to find out where to pay my gas bill, and I need to find out how to manage my bank account. And that has nothing to do with my mental health. So we kind of came back to the drawing board a little bit and created paperwork that was more user-friendly. And as Stephen mentioned earlier, technology is fantastic, but is a challenge for our aging population. As an agency, we send most of our paperwork out electronically. So people are signing their releases electronically, they're signing their consents electronically. That does not work for this population. So we really had to come up with an in-person way to do that. So we actually developed a needs assessment that focuses on some basic things: transportation, utilities, food. And then as the questionnaire goes on, we get more into, when's the last time that you were out of the house? Do you have friends? Does anyone come to see you? Those kinds of questions. And we send a case manager to the client's home to do that needs assessment in person with the client. We've developed relationships with our referral sources. A lot of our referrals come from Adult Protective Services, or they come from family members. They can come from anywhere. But what we try to do is, again, we learned some other things about the population. A lot of the aging population, they don't answer the phone. So we would call and call and call and try to get appointments scheduled, and we just weren't getting any answer. So we reached back out to the referral source, and they said to us, oh yeah, we tell them not to answer the phone if they don't recognize a number, because there's so many scams and they're getting called all the time. And that was just something we hadn't thought of. So we said, okay, great. How about if we go together? You already know the client, you've referred them to us. Maybe we could go together to the client's home at the same time. The client would feel more comfortable because they already have an established relationship with you, and that just might help us get in the door. So we started doing that. We call them warm handoffs, and it's been really successful. We've had a lot of success with that and really been able to connect with people. So we're really excited about that. So we conduct a needs assessment, and then the case manager develops a treatment plan with the client. Most of the time, we go in addressing some basic needs. And once a relationship is developed and established, that's when we move into a little bit more mental health focused kinds of topics. People are a little more comfortable with their case manager, so they start to talk about things that are a little more related to mental health. Like, I really wish I talked to my kids more, or I would like to go to bingo, but I can't get there. Those kinds of things. And oftentimes, a lot of that might be related to barriers, but might also be related to depression, anxiety, all of those kinds of symptoms. So we're working to reduce barriers and access to care. As a result of the social isolation that we've seen a lot of, we thought, what can we do to help our population, our clients, reduce that in a way that's fun and healthy and appropriate? And we were able to get some funding. We are funded from our local mental health boards. I didn't mention that earlier, but it's super important because we are funded with grants in all 3 of our counties, so that all of the services that we provide to the aging population are free. They don't have to pay any copays. They don't have to pay any deductibles. All of the things that we cover are free of charge, which is also very important. So we were able to get a separate kind of grant, and we decided that an ice cream social would be super fun because it's summer and everyone loves ice cream. So we kind of we found a DJ, and we found an ice cream truck, and we went to a local park that's right on the lake and provided transportation. We partnered with one of our county's local transportation system so that they could go out and bring the clients to the event. So transportation wasn't a barrier, money wasn't a barrier. And it turned out fantastic. People had a really good time. They ate a lot of ice cream, but they also played a lot of games. We played music, that was relevant for our population. We had games that were relevant for the population. And it was really just exciting to see people socialize and play games with people that they never met, and talk over ice cream and enjoy the park. There's a ramp that goes all the way down to the beach, so people were able to access that kind of those kinds of amenities as well. So it was really fantastic. And what that taught us is that we want to do a lot more of those kinds of things, because these kinds of opportunities don't really exist for the population, or there's a lot of anxiety around that. When we refer people to senior centers, or we refer people to existing programs, they say things like, I'm not going there. That's for old people. That's not for me. And we have a really hard time getting clients to participate. So we're trying to come up with new programming to really decrease the social isolation. The other thing that we are working on is just resourcing in general. Housing in our area, housing is very scarce. We have lots of problems finding appropriate housing for our aging population. If it exists, it's often very expensive and unachievable. All of the rent controlled apartments or income-based apartments in our communities they have endless wait lists, really, really long. So we're always looking for housing alternatives. And as a part of that, we can fund a lot of other things. We developed a fund within our agency where we take a designated amount of our own money, the agency money, and we set it aside, and it's called an I-Assist fund. We set it aside for things that might come up for our aging population that is difficult to get covered with other community resources. So some examples of that, we bought somebody a microwave because their microwave, they exploded something in their microwave and it didn't work anymore. We were able to use the I-Assist fund to get a microwave. We have gotten a couple bicycles for some of our aging population clients that are like, I would really love to go back out. I would really love to ride my bike. That's been really exciting. And then doing some basic things like helping to pay bills, um, helping to pay rent. We try to get little pots of money for different things. We've got a pot of money that we can help pay rent with. And sometimes people will say, well, I don't need you to pay my rent. My rent's taken care of. And then we start to ask questions like, okay, but did you fill all your prescriptions last month? And did you have enough food? Because oftentimes we find that they will budget money for their rent because that's a bill that they have to pay. And then they'll skimp on other things, like they won't fill all their medications or they won't get all of the food that they need. So we work with them to say, let us pay the rent this month so that you can take that money and use it to get the other things that you need just for some relief. So we're always looking for creative ways to offer support as well as uh, addressing mental health issues. And oftentimes, when you meet, we find that when you meet those basic needs and when people feel comfortable in their home and they feel safe and they have enough to eat and they can take their medication, all of a sudden they have more emotional space to process things like depression and like feeling sad and isolated. And so it makes a lot of sense. You know, when your basic needs are covered, you have you have headspace to focus on things that are a little bit different. So that's what we're working really hard to do up here in Northeast Ohio, and we're very excited to be able to do it. And we hope that we can expand the programming and continue to partner with people and come up with some other creative opportunities to serve the population. Because again, we find that that population is growing quickly and it's underserved. So thank you.
Absolutely. Thank you, Sherry. And I
Of
love these
course.
examples. I love a good ice cream social. I think what a great way to bring folks together. It's something that, it's nice to bring folks together and it's something that we all like. So I know we have a little bit of time held for some Q&A. So I'd love to hear from you about, what was a key highlight that you learned about in today's discussion, or perhaps something that you brought up in the breakout room that we didn't quite get to touch base on. And you are welcome to unmute or share in the chat. What questions do you have for our presenters today?
Oh, Tessa, I was just going to share something from our group, our breakout group. You know, we were talking a lot about our personal experiences with our own, aging family members, but particularly around the idea of one, this is a good opportunity. And, the conversation itself is causing us to be a little bit more observant and aware of how isolation is impacting others, particularly post-COVID. But I think one of our committee members was actually offering out and talking a lot about, senior living facilities and that, there's still, people in congregate housing, there still a lot of concern and attention paid to, just being exposure levels for a variety of health reasons or comfort levels. And just noticing that some of the spaces in those congregate housing facilities might have been used for community building in the past, but visits, that room is always empty now. And so just more of a hesitation, fear, probably from a lot of areas where maybe that hadn't been the case, 4 or 5 years ago.
Absolutely. Thank you, Jen. Yeah, I think our perception and our activities are really shifting, which is a great thing. What else?
our breakout room, we discussed as far as being able to communicate, especially with the older population, just to like do a check-in. As Jen talked about, like your senior citizen places, our senior center here in Pickaway County, we're Central Ohio. There's a lot of activities, but sometimes that transportation can be a barrier. Maybe they're afraid to drive. We don't have a real bus line, if you will. We are rural America, and so unless they can hook up with another friend or something like that to take them to the senior center, they would have to make arrangements through our PICA, which is our community action agency, to say, okay, I'd like to be picked up to do these activities and then take me back home. It's sometimes they charge, just all depends on finances, but they're again trying to keep everybody in the loop. And with all this wonderful technology, it can be a little straining for them.
Absolutely, absolutely. I see a comment from Barb in the chat. She said, I love the idea of a pot of unrestricted funds to meet whatever the need is. That makes sense. Mental health, energy, motivation improves when basic needs are met. Absolutely.
We love the pot of unrestricted money too, very much, because most of the money we get, has really, really stringent guidelines on how we can spend it. And we just decided as an agency that we just really want to give back to people. We do this work because we're passionate about it. We want to give back to people. And we just thought that this was a really nice supplemental way to do that. So there wasn't so much stress over things that they couldn't get covered in another capacity. It's really hard to, get someone to buy you an air conditioner or get you a fan or those kinds of things. So we love that money too.
And I just want to say real quick, that really is a great idea because you're addressing so much. It's really hard for me to want to address maybe any mental health issues that I have when I'm worried about the fact that I don't have dinner tonight, or the lack of having an air conditioner is exacerbating my depression. So I think by doing that, you're addressing multiple needs at once. And I think that's something that older adults really, really need, is just to address more than just this one thing, but how this one thing is affecting the 5 or 6 other things that you're dealing with.
Yep. Or or in my mind went the lack of having an air conditioner is preventing me from being comfortable enough to ask the neighbor over for lunch or, a
Right.
glass of iced tea or whatever, right?
Mhm.
Two things that are coming to my mind that this group might be interested in, as we focus for Healthy Aging Month here at the center. We typically release a blog article or two every month. We've got two coming down the pike that should be out here very soon. The first one just brought in my perspective about the various lenses of grief and how that impacts older adults. It's not just loss of life, right? Grief and loss can happen in so many ways. So that might be worth checking out when you see that cross your inbox. The other one, gosh, and I'm sorry, I can't remember who was just mentioning that sometimes technology, it puts up a barrier or can be another level of intimidation for senior adults and even for those who aren't seniors, like maybe myself, who's not comfortable with new technology. But the idea that, and Stephen, your colleague Terry has been seeing really, really good outcomes in using Alexa and as a
Yeah.
device and helping the folks you guys work with to program Alexa to do check-ins and drop-ins and foster social interaction between folks. And we heard about that and just thought it was brilliant.
Yeah, I have two very quick stories about how wonderful that is. So when that program first kicked off, I was still a service coordinator, and I had just bought my first Alexa at the time. So I'm not only learning it along with the residents, but they're coming down and they're like, I can listen to this and I've got reminders for this, that, and the other. So that's great. A wonderful story. Two neighbors both had Alexas, and both enabled the drop-in feature. And so every day they would remind the other about their doctor's appointments or their medications or back and forth. And to this day, they're still like the best of friends. They didn't talk much before they both got Alexas, but they figured how to check in on each other. And it's great seeing people take care of each other, so that yeah, it's been wonderful. Residents still have them, still use them.
That's amazing. I love it. And I love that it's technology that isn't necessarily site dependent. It isn't necessarily like we have some dexterity challenges or any issues going on. It's voice enabled. So that's really wonderful. Well, thank you all so much for today's discussion. Sherry, I just saw you on mute. Please go ahead.
I was just going to say, I love that idea. It's fantastic. And I'm immediately going to talk to the case managers about getting everyone an Alexa. I just think that's fantastic. So I appreciate that you shared that.
It's really great. Yeah, thank you so much. Thank you everyone for joining us today. Thank you for this discussion, and a special thank you to Sherry and Stephen for sharing your program, sharing your successes. I think this is really a bit of inspiration for all of us to really think about how we can meaningfully work with older adults, recognizing that realities change for folks, and recognizing where folks are. I think it was Stephen who said a 55-year-old is different than a 75-year-old, recognizing that people, there might be slightly different dynamics by generation, and so we just need to be thoughtful when we're working with folks. So I'm going to hand this over to Jen now to kind of drive us home, and I'm going to share my screen so Jen can walk us through the last couple steps of today's work.
Thanks, Tessa. So, and I think, Sherry, you teed me up perfectly. Maybe not in the right order, but there is a slide here, in a little bit. If you're not already following the center, on social media, thanks, Tessa. Go ahead and follow us. You can sign up to receive our monthly newsletter. The newsletter is probably going out tomorrow at this point, because I can't put any more hours in the afternoon. But September's newsletter is ready, full of content, social media toolkits about how we can support healthy aging in our seniors, our older adult community. But we will have a bonus blog that will not be part of the newsletter, and that's the one with Terry talking about how Alexa has been used to combat social isolation in senior adults. So once that is ready, we're going to post it on all of our social channels. So if you're not following us, go ahead and follow us. Otherwise, check back on our website in probably about a week. But Tessa, if you would go back to that next slide. You probably heard me mention that today is our very last prevention exchange, and that's because we want to make room for a new project the center is embarking on. We are launching the world's very first behavioral health prevention and promotion project, ECHO. ECHO is an evidence-based model that's used around the globe with a model of all teach, all learn. And as we learned more about ECHO, Project ECHO, we realized prevention exchange is kind of a ECHO light. It's a little less structured, but really it's based on the idea that the wisdom is in the room and so many opportunities to learn with and from each other. So we're starting with 2 ECHOs, one focused on youth vaping prevention and the other focused on adult low-risk alcohol consumption. And we'll probably grow to include some youth-led work in there, as well as some just advanced professional development for Ohio's prevention community. And the way this works as an ECHO is a series of sessions that all kind of have a similar topic in mind. So in this case, youth vaping prevention, adult low risk drinking. They're all 60 minutes long. You hear from a subject matter expert. You come ready to workshop your idea around that particular topic. And I know the text on this is small. The QR code will take you to the landing page on our website, and if I stop talking long enough, I'll drop it in the chat as well. But you register once, all 6 sessions pop up as a calendar invite, and you just attend. You attend based on your availability, and we do have CEs associated with each of these sessions. We heard that loud and clear. People love prevention exchange, but one of the drawbacks is that we weren't able to offer CEs because of the format. So we're really, really thrilled that following this ECHO format, we'll definitely offer CEs for 6 or 7 disciplines actually. So all are welcome. The QR code in the middle of the screen will take you to the homepage where you can register for either ECHO and just be watching for more topics to be added here as the months go on. So we're going to start small and follow it anywhere, but none of this would be possible without all of the amazing feedback you have provided with us over the last 20 months during Prevention Exchange and other outlets. So we're excited to continue this journey with you and really, really appreciate you sharing your time with us today. And so if you haven't yet, if you're looking for more resources for healthy aging and working with older adults and you're not receiving our newsletter, head on over to our homepage. Again, I'll put both of those links in the chat so you can sign up for our newsletter. And then just a very special, once again, thank you to Stephen. Thank you to Sherry for all of your work to support the center. And it was really great to hear about all the successful things you're doing in your community. Thanks, Tessa. Or Sophia. I'm not sure which one of you are driving, but thank you for making it possible so I don't have to.
And thank you everyone for joining us today. I hope you have a wonderful day. I'm going to go ahead and stop our share, but we just really want to thank you guys for all of your attention and all of your energy. It was a great session. Thank you.
Goodbye. Have a nice long weekend.